Abuse starts as using a substance, legal and illegal, in the wrong way. Drugs can be abused without having an addiction, but most addictions begin as substance abuse. Addiction is when a person has no control over whether he or she uses drugs or alcohol. Someone who's addicted to cocaine, heroin, or alcohol has grown so used to it that they have to have it. Addictions can be physical, psychological, or both. Physical addictions are when your body becomes dependent on a substance. Being psychologically addicted to a substance, the desire of wanting the substance becomes overwhelming and emotional. The line between abuse and addiction is crossed when a person becomes dependent on drugs or alcohol. If alcohol use becomes harmful to the body, it is then considered to be alcohol misuse and abuse. Some signs of addiction are changes in mood and weight. The most addictive type of drug used in the world today are narcotics such as heroin, morphine, and oxycodone, which are sold illegally unless prescribed by a doctor. Narcotics are drugs that dull the sense of pain or cause drowsiness and sleep. Narcotics are very addictive and change the way the brain and the body work. Many individuals start breaking laws, rules, and doing dangerous things. Substance abuse has a connection with teenagers, drug abuse, and STDs. Injection drugs such as heroin, cocaine, and steroids connect drug abuse to the spread of HIV and hepatitis C. Teens are at risk of sharing unsterilized needles with infected blood left behind in them, which is one way the infectious disease is spread. HIV weakens the defense against illnesses. It can kill you over time. Scientists have found that drug addiction is a brain disease in which drugs of abuse change the way the brain functions. Because of their addiction, some injection drug abusers may not even realize that their ability to make decisions are impaired. Researchers have found that those who started using drugs and alcohol when they were young took more part in sexual risk when drugs affected their way of thinking, which puts them at more risk for HIV. In 2005, 38 million people worldwide were estimated to have been affected with HIV, and it's hard to fathom that 25 years ago, no one knew what AIDS was.
So we see a lot of parents who come in with questions about kids and how they can help kids prevent problems that are going on, and possibly your child has had an episode where they have had an issue with the court or a problem at school. They've had something and they're wanting to figure out what they can do before it becomes a serious problem. So we deal with a lot of parents.
There are multiple steps in getting over an abuse or an addiction. Not only are support groups needed, but people also have to be willing to help themselves. Seeing a healthcare provider and making plans to stop using drugs and alcohol is an essential first step. There are many programs in Owensboro available for help, such as River Valley Behavioral Health. The second step in this process is to be getting support from concerned friends and family members and learning to manage stress. Thirdly, individuals need to take care of their physical health. Getting 8 to 9 hours of sleep at night, exercising, and dieting will keep them healthy and feeling great. To complete the process, most importantly, individuals should avoid situations where people are more than likely going to use drugs and alcohol to keep themselves from relapsing. Using this process can save lives.